I really enjoy treating carpal tunnel syndrome because patients are ecstatic to go from 8 out of 10 pain, really debilitating pain, down to a 0 pretty quickly. The key to truly fixing carpal tunnel isn't just focusing on the wrist, though. Research shows that more than 87% of carpal tunnel cases actually originates from nerve root compression, more along the base of the neck. It is a very, very common area to find nerve root pressure in because, unfortunately, most of us have poor posture or had poor posture at some point in our lives. We've all been to school. We've all sat for 6+ hours a day. And a lot of times that right there is the very beginning of why this ailment shows up multiple decades, sometimes even later. Despite the evidence, though, most treatments still only address the wrist. And the more common form of treatment in our current medical system is for carpal tunnel is surgery. And the surgery involves cutting the actual flexor retinaculum of the wrist, which is a pretty tight ligament, kind of like my watch here, that holds our carpal bones together. What the surgery does is it allows for expansion of the carpal bones and therefore less compression of the affected nerve, which does provide pretty immediate pain relief that patients are excited about post-surgery. But this can sometimes last for maybe a few weeks, months, or hopefully a few years at least. And then the pain, I hate to say, but typically comes back. From there, unfortunately, if that happens, these people are realistically forced to come in and see us because they didn't know that we could fix the root cause of their problem the first time. What we do is we relieve the pressure off of this typically very tiny area with chiropractic adjustments. Usually these adjustments have you laying face down so that we can gently guide the vertebra back into its proper position. We trace the nerve root irritation down through the shoulder, the elbow, the wrist, making any additional or other necessary adjustments along the way if needed. By treating the whole neural pathway, we help our patients get lasting relief, often much faster than expected.